My name is Dr. Rachel Thorneloe, and I'm a postdoctoral health psychology researcher at the University of Manchester, and I was the lead investigator on this study, which examined non-adherence to medication in patients with psoriasis. This study was part of a studentship jointly funded by the Medical Research Council and an award from the Psoriasis Association of Great Britain and Ireland.
I'm Liz Cordingley. I'm a health psychologist and senior lecturer at the University of Manchester. I was lead author on the paper.
We did this study because medication adherence is the key mediator between medical practice and clinical outcomes. Medications do not work in people who do not take them. And currently, we know that levels of medication adherence can be low in people with psoriasis. And so, in order to improve our understanding of medication adherence, we explored in depth patients' experiences of psoriasis medication usage.
How did we do this study? Well, we interviewed 20 people with psoriasis and we asked them to reflect on their experiences of taking psoriasis medications. We also asked them specifically about their beliefs about psoriasis and about psoriasis treatments. And finally, we asked them about their experiences of following healthcare advice given by their healthcare professionals. And together we looked at all the interview data and analysed it using framework analysis. What were our main findings? Well, we identified a number of key themes. The first theme was that people talked about adhering to medication as depleting their coping resources. This wasn't just a matter of time, but it also depleted motivation to engage in other activities, even those that would have improved their health, such as taking exercise. And that in particular is something that we know is a problem for people with psoriasis. The other key theme that emerged was that patients found it emotionally as well as practically demanding to take their medications, even when they explicitly recognised the importance of adhering. Taking a tablet, taking an injection or using topical treatments was a concrete reminder that they were living with a long-term condition. They talked about treatment as being constantly emotionally demanding. Even patients who were highly adherent talked about ongoing concerns about treatment taking. They had very real fears about adverse treatment effects, about loss of treatment efficacy, or about running out of treatment options. And for many, this was a very frightening thought. So what does this mean for psoriasis in the long term? We found that some patients continue to use their psoriasis medication, which is good for their psoriasis, but they remain distressed or unhappy. Other patients made different choices. They chose to reduce the amount of medication, or they overused medication, or they even rejected their treatment options altogether.
Patients can still be experiencing high levels of distress and treatment uncertainty, even if they believe their treatment is necessary for their psoriasis and they are adhering to their treatment. Patients' beliefs about their psoriasis and medication play a key role in medication adherence. It is important for clinicians to know what the patient expects from their treatment, if they have any concerns about their treatment, and so on. Being able to discuss these things openly can help support effective self-management.